I would also like to share what could be the myths and what exactly are the realities in this field of liver transplant anesthesia. The reality, which has been my experience for the last 16 years, is that it is very, very satisfying. It is one of the branches of anesthesia which actually puts you in the driver's seat. If you talk about being a pilot of a plane, that is what you are. The results in the field of transplant surgery are as much dependent on anesthesiologists as they are on the field, surgical skills. The field has developed marvelously from being an open procedure to a laparoscopic procedure to a robotic procedure. Every bit and every minute of liver transplant anesthesia is particularly exciting. The idea is to observe, then the idea is to have a collateral thinking and always have a logical bent of mind on what is happening and why it is happening. Because this is a field which actually produces a lot of rush in adrenaline. Any moment, any time, anything can change. From a stable patient, you will have a highly unstable patient, and then you'll have to look for causes. In the field of anesthesia, your training could advance to look at advanced monitors as well as to look now in transesophageal echocardiography, which has also become an essential part of training of liver transplant anesthesiologist and has to have a fellowship with that also. And to look at the myths. The myths could be many things: that you don't get breaks, you have a lot of stressful situations. You could talk about the work-life balance here. Then you could talk about how the results are. But let me tell you, whether it is LDLT or a DDLT, the field is very exciting. And with an open-minded and an open-ended questions in your mind, you can really build up a very strong career in this field, as well as what could be the financial aspects would also be an important factor in deciding to take this field. And I would be discussing that also in my future videos. Thank you.